According to the Guttmacher Institute in their article, Sex and HIV Education, last updated in 2020, 28 states require sexual education, and only 17 of those require that sexual education be medically accurate. Let me say that one more time. Only 17 states in the United States require that sexual education be medically accurate. The absence of accurate sexual education is a large contributor to the fact that Angelica Green writes in her 2018 article, The Impact of Sexual Education on Sexual Activity and Pregnancy Awareness in Young Adults. Green states that the percentage of adolescent females between the ages of 15 and 19 becoming pregnant in the U.S. is higher than all other industrialized countries, and the contraction and transmission of STDs and infections continues to rise. Medically accurate sexual education should be a requirement in all schools. Today I will identify the problem with current sexual education requirements in my ill, identify those responsible for this issue in my blame, suggest a potential course of action in my cure, and weigh the costs and benefits of implementing this solution. Now that I have provided an outline of my argument, I will move on to discuss the issue and the ill. Elementary and high school aged children are not receiving the degree of sexual education they need to make informed decisions when it comes to sex. This problem has caused the United States to have high rates of teen pregnancy, abortions, and STDs. This problem affects millions of preteens and teens across the nation. They are being misled or completely uninformed about the way their sexual organs and hormones work. Denying them this information causes detrimental effects as it increases incidences that could be prevented by being informed. Some of these incidents include STDs, unwanted pregnancy, and abortions. And this can lead to other things, like babies being born into homes they're not welcome into or mental health issues. Now that I've discussed my ill, I will move on to the blame. For this argument, I will be blaming the federal and state governments alongside with society for mixing religion and stigmas with medical education. The divide between religion and science is fuzzy for many people. Abstinence only until marriage curriculum is the only federally funded program that has been created, but the information taught from this perspective rises concern from medical and public health professionals, sexuality educators, and the human rights community that AOUM withholds information about condoms and contraception, promotes religious ideologies and gender stereotypes, and stigmatizes adolescents with non-heteronormative sexual identities. This was from the State of Sex Education in the United States by Kelly Hall in 2016. Now that I have discussed where the blame should be placed, I will move on to my proposed cure for this issue. All states should be required to accept a federal policy where students are required to receive medically accurate sexual education as part of their regular curriculum. Green states, with the increasing amount of research, the hope is for schools and other organizations to adapt their sexual education programs so that they are most effective for the adolescents who would participate. While accurate education is still not required in all states, the increase in research and discussion of the topic is creating a move towards the right direction. Green also discusses the factor of age. The sexual education in classes where it is required usually targets teenagers in high school, but many organizations are making the move to teach children as young as in 6th grade. While some people may see this as an inappropriate age to discuss sex and topics as such, many children have often engaged in unsafe practices before high school. If children are taught in middle school, it will likely help prevent children from experimenting with sexual activity because they will already have the knowledge they need to make safe decisions. It would be difficult to get religious parents to accept the proposed laws, and money would have to be allocated to research and create curriculum. But at the federal level, the U.S. Congress has continued to substantially fund AOM, and the funding was even increased to $85 million a year, according to Kelly Hall in her 2016 article, The State of Sex Education in the U.S. Redirecting those funds would not be difficult considering the amount of funds already allocated to AOUM education. The National Association of School Nurses stated that evidence-based sexual education reduces sexual risk behavior by delaying sexual initiation, reducing pregnancy and STIs, and increasing contraceptive use. This was from their 2020 article, Sexual Health Education in Schools. Fixing this problem would cause a butterfly effect of positive benefits. Educating children would reduce pregnancy, abortions, and STDs, reducing the amount of funds necessary for programs involving those issues. Medically accurate sexual education should be required in schools. In my ill, I identified the problem to be that as a result of or no misleading sexual education, rates of teen pregnancy and the spread of STDs are shockingly high. In the blame, I suggested not only the government, but the influence of religion has on citizens and political decisions. In the cure, I proposed what should be done to educate children and lower these rates. Then I identified the benefits of a more sexually educated youth. Change is on its way in the U.S. and in the world. Science grows every year, and it is our responsibility to make sure the younger generations are properly educated.